bored, just give me a sign, I can stop. Because this is a topic which is close to my heart, and Deepthi has already told you good, nice things about me. I wish my mother was in a status to hear this. Unfortunately, she is in dementia. She doesn't even recognize me. So I feel sorry for that, but I wish she was there and could understand what you did, because all mothers feel proud of their sons and daughters, even if they have not achieved anything. Thank you, Deepthi.
That's really
Now,
sweet, doctor.
we are going to talk on kidneys, which I call the amazing organs God has given us. God has given us 2 kidneys, and you must know that 1 in 1,000 will have only 1 kidney. So, which means the common question asked is, why has God given us 2 kidneys? And this is a question which answer over the years I thought over it. I think one is for you, the other one is for your loved one to donate. That's my feeling. Go back to your school days, your botany teacher would have told you that beans are kidney shaped, and your zoology teacher would have told you the kidneys are bean shaped. So you take it whatever you are. Now, I have given you a picture here of a man and woman and tells you where the kidneys are placed, the back, on the side of this spine. This is very important to know, because in Chennai in 1982, I joined the Christian Medical College, Vellore, as a young nephrology student. And every week I would have in the nephrology OPD, one man coming to me with kidney swelling. And invariably it was a swelling of the testis, and he thought testis was the kidney. The scrotum would be swollen, it was hydrocele, and he would come with kidney swelling. And it was called Madras kidney. Scrotum was called Madras kidney. Things change after that. I'll come on to that later on. Now, I always start off my talk with quoting Homer Smith. He was probably the first renal or kidney physiologist from the United States, and he wrote a book called Fish to Philosopher. If you read this quotation, I read this quotation as a young medical student in 1971, 50 years ago. My professor of physiology, Dr. Krishna Rao, said, superficially it might be said that the function of the kidney is to make urine, but in a more considered view, one can say that kidneys make the stuff of philosophy. When I heard this statement, I thought my Professor Krishna Rao is a bloody fool, and Homer Smith must be a greater fool. All of us know kidneys make urine. What does it got to do with philosophy? Then 1982, I joined the Christian Medical College, Vellore, as a nephrology student, and those days, the concept of nephrology was not there. Very few kidney specialists. On the first day in the emergency department, I was called to see a 25-year-old boy from Bangalore in an unconscious state. Because I was also from Bangalore and the boy was from Bangalore, the family spoke Kannada. They came, 100 people were surrounding the boy and told me the boy is in coma. Somebody said he's got kidney failure. Please do something. And they were mobbing me and I didn't know what to do. So I called my professor of, my teacher, my guru, Dr. J.C.M. Shastri. He's an erudite, learned man. He's no more there. In 96, he died. I told him, sir, there is a young boy from Bangalore, and I'm surrounded by 100 people who are mobbing me. I don't know what to do. Then he said, you say he's got kidney failure, and most kidney failure people will have low hemoglobin and will require blood. That was the concept. Those things have changed. So what he told me was, don't announce now that you need one of the family members to donate blood and see what happens. So I came and told the family, 100 of them, I said, this boy needs blood. One of you immediately have to donate blood. Out of 190 disappeared. In the course of a few weeks, we realized the boy needs kidney transplant, and we had to tell the family that one of their family members has to donate kidney. It so happened we met the father. The father told me, Doctor, Nanu kelsa madanu, I am a very hardworking man. So give me a few days time, let me decide. Then we asked the sister of the patient to donate. The sister said, I am willing to donate, I want to save my brother. The sister's husband said, nothing doing, there's no way my wife is going to donate. Then we met the brother. The brother said, I am willing to donate, but the brother's wife said, nothing doing, there's no way my wife is going to donate, it's not possible. Then I came and met the mother, and the mother told me, which still haunts me in my mind. She said, Doctor, nan ಎರಡು kidney ತಗೊಂಡ್ಬಿಡಿ, ನನ್ನ ಮಗ ಓಡಿಸಿ. He said, please take both my kidneys, let my son live. So that actually taught me the question of philosophy and kidney, and I learned that Homer Smith had something when he talked of kidney and philosophy. Now, this is a story which is going on for the last 30, 40 years. I'll come to that later on. Now, once you talk of kidney, what are kidneys? Kidneys are amazing organ. We already said it is bean shaped. 1 in 1,000 has got one kidney, but by and large, we have two kidneys. And the main function of the kidney is to purify blood. It's a filter and purify blood. But more important than that is the kidney has got various other functions, which is normally not known to most people. You must know that kidney size is size of the fist. Every time the heart pumps, 20% of the entire cardiac output goes to the kidney. That means it's such an important organ. A small organ with so much of blood supply, which means when so much of blood is going, there are also problems because the toxins also, when you take some toxins, they also go in large number to the kidney. So the kidney is vulnerable for damage. Now, apart from filtration, let me give you some few examples what all the kidneys can do. This is a cartoon which will tell you what the kidney does. It removes toxins, which is commonly called urea, creatine. So many toxins are there. We eat so many things. What we eat, the meat, whatever we eat, they get into toxins. They are excreted by the kidney. The kidney also maintains the bone. This is very important. A lot of people don't know the kidney activates what is called vitamin D. We know that vitamin D, it comes from the skin. You need sunlight. But finally, for the vitamin D to work, it has to be activated by the kidney. If the kidneys don't work, the vitamin D will not be there. There will be calcium imbalance, and the patients could have what is called as renal rickets or kidney rickets. In fact, children with kidney failure, they have deformed bones because of the renal rickets. Then the next thing is kidney is important for hemoglobin. Your blood is red because of a substance called hemoglobin. The hemoglobin is able to function because of a hormone or a kidney. So if the kidneys don't function, you'll have low hemoglobin or anemia. The kidneys are also important for electrolyte balance, sodium, water. Now you eat a lot of salt, chips. If the kidneys don't work, these salt, water, sodium cannot get excreted and you will have problem. Then it is also important, the kidneys, to maintain the acid-base balance. So in effect, the kidney is a master. Another important thing, as I said, the electrolytes is potassium, sodium, potassium, bicarb, all this is important. So the kidney, in effect, is a master organ, is a chemist. It involves in not only removing or maintaining the chemical balance. In fact, there is another French physiologist called Claude Bernard. He said the kidney is important for maintaining what is called milieu interior, the French term for internal environment. So your entire chemical balance is maintained because your kidneys function well. That's why you read this statement. Bones can break, muscles can atrophy, glands can loaf, the brain can sleep without immediately endangering your survival. But when the kidneys fail to manufacture the proper kind of blood, neither bone, muscle, gland, nor brain can carry on. So if the kidneys don't function, then only we get all the problems going on. Now, this again is common condition we call uremia. All kidney specialists and anybody dealing with kidney will tell you, when you have kidney failure, we use a term called uremia. Uremia is a Greek term, literally meaning urine in the blood. So that means advanced kidney failure. Uremia means advanced kidney failure. Now, go back to this picture here. I've told you in brief, when you have kidney failure, you must understand the patient with kidney failure can go into any department, any specialty with symptoms. Now, you look at MGR here. All of you know MGR, who's the former chief minister, a famous actor. Even though people swear by MGR, he had kidney failure. But when he went in 1984 to the emergency department of Apollo Hospital, he went with breathing difficulty. Initial diagnosis was he's got asthma. That was the diagnosis. But a smart doctor, young doctor, checked his blood pressure and found his blood pressure to be 200 by 140. And he realized that it is not asthma. They did some blood tests, found out that his kidney functions were severely deranged. He needed emergency dialysis, and the story was different. And he had transplant, all that I'll come to later on. Now, you look at this man, Jayaprakash Narayan, 1977 emergency time. That is the time actually Jayaprakash Narayan had kidney failure. He was on dialysis. Till that time, actually, to be honest, even as a medical student, nobody knew what kidney failure was. Till Jayaprakash Narayan came in, and the concept of dialysis and other aspects of dialysis came in because of Jayaprakash Narayan. Now, of late, A lot of people have got kidney failure. Ananthamurthy had kidney failure. He was in peritoneal dialysis. You have two eminent politicians who had kidney transplant. Until recently, I didn't know that he had transplant, but we knew because I know the doctor was treating him. He had transplant 4 years ago. He had not told anybody, but now he is using that transplant as an excuse for not coming into politics. That's a different story. Now, when you look at kidney failure, the patient with kidney failure can go into the pulmonology or the lung department with breathing difficulty and cough. He can go or she can go into the neurology department with epileptic fits or convulsions, we call it, or they can go into coma. They can go into the gastroenterology department. I look at from your website that my close friend and eminent gastroenterologist, Dr. Naresh, but I think recently addressed you. Say they can go to his department with vomiting blood. They can go to the skin department with itching. The commonest cause of itching in Bangalore is mosquito bite, so don't get worried. Next time you get itching, don't think it's kidney failure. Or they can go to the eye department with loss of vision. So these are all the problems when you have advanced kidney failure. So the kidney failure can masquerade into any department. Now, when you say kidney failure, there are two types of kidney failure. One is called acute kidney failure, which is temporary. Other is called chronic kidney failure, which is permanent. When you talk of acute kidney failure, this is very rewarding. This is occurs commonly due to, in our country, when you look at acute kidney failure, my teacher, Dr. Shastri, would say 4 Ds. He said diarrhea, doctors, drugs, dehydration, and deadly snakes. That was his way of teaching us that acute kidney failure is something which occurs quite common. In India, gastroenteritis. You go and eat some pani puri on the roadside, you have severe diarrhea, you're not rehydrated well, you can get kidney failure. But you must remember, some of these acute kidney failures can go on for some time, and if you support them with dialysis, in a few weeks' time, they recover. Now, this is very important. A lot of patients come to me with chronic kidney failure, where the story is totally different. When you talk of chronic kidney failure, the story is a permanent kidney failure, where dialysis goes on for long. Now, with acute kidney failure...
Can I stop you for a second, please?
Yes,
just wanted to tell you to slow down a little so that everyone can absorb what you're saying. We've had, situations in the past where it seems too fast for the audience. So just to slow down a little bit.
Okay.
Thank you.
Thank you. So when you talk of acute kidney failure, it is something which can be treated. So if somebody is having acute kidney failure, it's a rewarding thing because few weeks of dialysis, give treatment, they will recover. Now, when you talk of renal failure, how do we diagnose kidney failure? The most important thing for diagnosing kidney failure is what is doing kidney function test, or by the biochemistry department, we do something called serum creatinine or the kidney number. I'll come to that later on. Apart from that, a urine exam will tell you whether you got a kidney damage. But the single most important thing, in my opinion, is doing an ultrasound, which will tell you whether you've got 2 kidneys, whether the kidney is small, whether the kidney is big, whether there's obstruction, there are stones. Now, next, I'll come into that. Now, this again tells you, I think all of you should remember this term, serum creatinine. When you talk of kidney, we talk of a terminology called serum creatinine, and my eminent colleague, Dr. Balal, used the term kidney number. Now, that is for a common man. If they can't remember the creatinine, we use the term kidney number. Now, look at this picture here. This is sent to me by my friend from Brazil, where even the metro stations have an advertisement saying that how serum creatinine is a very important marker of kidney function. In fact, my friend's car carries a statement here: high creatinine is more dangerous than high cholesterol. If you have a cholesterol of 400 or 500, nothing will happen to you. But if you have a high creatinine, that can kill. So the take-home message is, please remember this kidney number or serum creatinine. Now, this is a group where silver surfers, where a lot of people above the age of 50, we have a condition called, in this age group, urinary tract infection. One of the cause of urinary tract infection in people above the age of 50 is something called prostate problem or prostatitis. Now, all men have prostate. Look at this picture here. This is a normal prostate. It is actually called an accessory sex organ because it secretes, apart from the testis being secreting semen, it has some secretion which helps in the coitus. Now, look at this picture here. This is the bladder and this is the prostate in a normal person. As you grow older, the prostate gets bigger and it starts obstructing the flow of urine. that's what happens. Now you have symptoms of prostatism, we call it. Now, the enlargement of prostate is something like me getting bald or somebody having silver hair. It is normal. It's normal aging process. The symptoms of prostate can vary. Somebody can have a symptom of prostate at the age of 50. Somebody at 80 can have. My grandfather, mother's father, till 100, he never had any symptoms. One of the things which there is a theory which is said is sexual intercourse is good to prevent prostatic symptoms. And my grandfather, who didn't have any prostate problem, he died at the age of 104. He had 18 children, so you can understand what he did. So that is another story. Now, these are some of the symptoms of prostate: getting up at night, more frequency, blood in the urine, urgency, you can't hold on, feeling the bladder isn't empty, hesitancy, dribbling of urine after urination, intermittently impotence, slow flow of urine. I think that is the commonest thing: slow flow of urine, painful orgasm. So if you have any of these symptoms, please consult a urologist. I'm a nephrologist, I don't deal with prostate, but please consult a urologist. And there is another number called PSA, or prostatic specific antigen. If it is very high, it could indicate prostate cancer or prostate infection. Doesn't mean cancer all the time. There can be a prostate infection which can be treated. So this is important in this age group. Now, one other condition which occurs commonly is kidney stone. Again, it's not my field. I myself have had kidney stones. I've had 2 surgeries for kidney stone. But you must remember that it is one of the causes of urine infection, one of the causes of kidney failure. And there are certain things. How do you identify you have got kidney stone? Pain, passing blood in the urine, painful urine, all that is there. But I think single most important investigation, again, will be an ultrasound. Now, how do you prevent kidney stones? There are certain important things which you must know is enough fluids, adequate fluids. When I say adequate fluid, there's a misconception. People think that drinking 8 liters of water, 6 liters. No, there is no need to drink 6, 8, 10 liters of water. God has given you something called thirst mechanism. As much as your thirst you drink, that should be suffice. That is the latest concept. Drinking too much water without salt can also be dangerous. Your sodium can come down, especially in the elderly. Too much water, low salt can cause hyponatremia. That can be dangerous. So taking enough fluids, diet rich in protein, salt restriction, preventing urine infection, obesity, these are some of the risk factors for kidney stone. Now let me go to the next slide. Again, this is an important topic for women, urine infection. Please understand, women by their anatomy are prone for urine infection. In fact, I would say it is a birthright of every woman to have urine infection. Every woman would have had urine infection at some point of the time, especially in the reproductive age group, what we call when they are going to have children, or we say in the sexually active period, the chance of getting infection are very high. But there are certain things you must understand. The urine infection in women, if it comes recurrent, that's the only time you have to get worried. When I say recurrent, more than 3 episodes in 6 months. If you get, then you need investigation. And it is important for women to know how to prevent urinary tract infection. So this picture again tells you, you must go to the bathroom as often possible. Emptying the bladder is important. I know in a country like India where women are working, toilets are not there, Modi is trying to do his best to get toilets, but nevertheless, there is a problem of privacy. Men have no problem. They just have to do like what Nike says, just do it. And that's the problem is solved. But women have problems, so we have to understand that. But I'll give you a simple example. A running river is difficult to pollute, whereas stagnant pond is always dirty. We are polluting even Ganges, that's a different story. But by and large, when you have a running river, it's not easy to pollute it. But a stagnant pond gets polluted. Same way with the bladder. If you hold on to the bladder for more than 3 to 4 hours, chances of the bacteria growing, infections are high. So it's important for women to understand that they pass urine frequently, they drink enough water, that's high hydration, and the way they also wash, how they wash after they go to the toilet. It's important. There are specific ways how you should wash, and that can prevent infection. Now, I can go on and on this, but I want you to know, women who are post-menopause, they are prone for infection too. And that is because of the hormone estrogen deficiency. They can have dryness in the urethral area and they can have infection. So any women having more than 3 urinary tract infections in 6 months, they need to be investigated. By and large, we call in the reproductive age group. In fact, there is a term called honeymoon cystitis. People who got married and the women will get some infection in the first few weeks or few months. That is normal. That is a normal way, and they will not get worried. But for young women, it's important after coitus to pass urine. That way, they can prevent this so-called honeymoon cystitis. That's the one. Next slide. Now, I told you about acute kidney failure. The story is different from chronic kidney failure. Now, look at this picture of a chronic kidney disease in the United States. As per the United States data, they have excellent data. At least 10% of all the Americans have some sort of kidney disease. It's a large number. 10% is a large number. And this figure in India is different. When you talk of chronic kidney disease, as I told you, as it's different from acute kidney failure, there are 5 stages in chronic kidney disease. And in the 5th stage, which is very important, what we call as end-stage renal disease or ESRD. This is a stage where life cannot go on without support. I'll come to that later on. Now look at the problem in India. Unfortunately, in India, we don't have any data. We have just started the CKD registry or chronic kidney disease registry. We don't have data, but we have something called guess estimate. I call it guesstimate. Based on our own experience, we can say that there are at least 250 new cases per million population occurring every year. Please understand, when I say end stage renal disease means patient requiring dialysis or transplant, 250 new cases per million population per year. That means 250,000 new cases every year. This is a large number. And this is going to add every year 250,000. So imagine the number which would occur. We're talking millions of patients requiring dialysis and transplant. Unfortunately, we are not geared to handle that sort of load in our country. When I started my nephrology career way back in '85, in Karnataka, we had only 4 nephrologists. Now we have got in Bangalore itself 100 nephrologists. Still, it is not enough. Look at the picture of the Indian Society of Nephrology. I was the first chairman of the Southern chapter. We have got about 1,500 nephrologists in India in my society registered. But look at the number of nephrologists of Indian origin in the United States, more than 1,500. America, the population is 1/3 our size, but look at the number of nephrologists of Indian origin being more than 1,500. That itself tells you how there is demand for this specialty because the numbers are growing in a mind-boggling fashion. What is the cause of chronic kidney disease? What is the main cause? 50% of the chronic kidney disease is due to diabetes, diabetic nephropathy. When I started my career 35 years ago, only 1% of my kidney failure was diabetes. Now it is 50%. Half my dialysis transplant population is due to diabetes. Now, if you look at the risk of ESRD, I've already told you how things are United States, India. In India, up to 10, 15, 20 years ago, 90% of our people didn't even know they had kidney failure and they died. They won't even reach the doctor. That way, ignorance was a bliss. You didn't even know. Most of them would die so-called heart attack. Because when somebody dies, the heart stops and the story will be he had heart attack and died. But maybe they had kidney failure, they were not aware of it. But that is the story in India. But again, I'm going to stress on diabetes. We are now competing with China. Whether you're competing with China and other things, we don't know. But I'm sure in diabetes, we are going to overtake China. There's no question at all. We are going to be the world leaders. In fact, my friend, Dr. Shashank Joshi, he tells me, he's a diabetologist from Bombay, he tells me, it's only a question of time. Every 5th Indian will be a diabetic and every 5th diabetic will be an Indian. So this is a story which is going to be dangerous, but you must understand that 30% of all diabetics will get kidney failure down the line in 20, 30 years. Now, let's come to kidney failure. This is quoted in 13th century. Hardness of the kidney is either not well cured or cured by no means. So those days, there was no treatment. But now we have treatment. Starting with mild kidney failure. What do you do? In mild kidney failure, you treat the blood pressure, you restrict salt. I'll come to that. That is the most important thing. And my friend from US, Professor Zadeh, is a professor of nephrology in California. He has done a lot of work on the role of vegetarian diet in kidney failure. In fact, he has a theory, and He's not, how to say, a Jain or something like that, but he has done a lot of work on vegetarian protein and vegetarian diet. And he says that has got a lot to do in postponing the onset of dialysis in chronic kidney disease. I'll come to that later on. So I'm a vegetarian, I'm biased maybe, but there is a lot of evidence to show that if you are a vegetarian, it helps in protecting your kidney. Now, the most important thing is blood pressure reduction. I think anyone having high blood pressure should get their kidneys checked. It is sad that a lot of people I know, when I go into the history, when they come to me with kidney failure, I ask them, have you had headaches? They say, I've been having headaches for a long time, but they never got their blood pressure checked. So even if you go for a skin problem or a tooth problem, any problem, please get your blood pressure checked. Anybody below the age of 40 having high blood pressure, there's a very high likelihood they may have kidney problem. This figure tells you how, if you have kidney problem, that is kidney is renal, your blood pressure will go. And if the blood pressure goes up, the kidney will get damaged. So it's a cycle, it's a vicious cycle. So you have kidney problem, blood pressure goes up, that damages the kidney. So you got to break that cycle by controlling the blood pressure. Now, once you have kidney failure, I told you got mild kidney failure, moderate kidney failure, and then you got the permanent kidney failure, which is the stage 5 called end-stage renal disease. When you reach that, what is the treatment? The treatment, what we call, is renal replacement therapy. That is, either we do dialysis, we do transplant, or the patient dies. There are only 3 options. When the patient reaches this stage where life cannot go on without some sort of support, dialysis, again, I'll come to, there are 2 types of dialysis, the machine dialysis and the peritoneal dialysis and transplant, we'll come to later on. But without some sort of treatment, a person with end-stage renal disease, or we say stage 5 of chronic kidney disease, will die. And that is an option. In India, there are 3 options we give. Majority, at least in the last, before 30, 40 years, when I started practice, majority would die because they won't even know they've got kidney failure. The other option was dialysis and transplantation. When you say dialysis, this is, you can see 1990, when I just a young man, I got a lot of hair at the time, taking care of patients. Now, being in the field for the last 30 years, I think I've become bald and old. Nevertheless, this is the old machine. These are the new machines where patient can be on dialysis without any pain. Olden days, dialysis was very difficult. The dialysis machine actually came in during the Second World War, treating kidney failures. The machine actually cleans the blood. And when we say dialysis, please understand, dialysis is a double miracle. It does not cure kidney failure. It keeps the patient alive. It keeps the disease alive. A person on dialysis has to be on dialysis lifelong or till they go for kidney transplant. I'm talking of dialysis in a chronic kidney stage, not acute. I told you acute kidney failure, few weeks, the kidney will recover. Dialysis for a few weeks may be enough. But in a chronic kidney stage, the dialysis is lifelong. Either it is twice a week or thrice a week, lifelong. The patient on dialysis is tied to the machine. It is 4 hours average, 3 times a week, or at least 2 times, and it is expensive. Now, this picture or this slide was made about 25 years ago. It says cost of dialysis is 15,000 per month. Now it's changed. We charge in Manipal Hospital 3,000 rupees per dialysis. So imagine 3 times a week dialysis is 9,000 into 4, 36,000 only for the dialysis. Then you're on various other medicines and support system, which costs you another 15, 20,000. So in effect, to keep a person alive on dialysis, average of about 50, 60,000 rupees a month is needed. So you must factor that. Now, the problem with dialysis, I told you, is even if you're Santa Claus on a Christmas Eve, you can't miss dialysis. You've got to be on dialysis. I don't care what day it is. 4 hours is 4 hours. That's what the nurse is telling Santa Claus on Christmas Eve. So that is the problem with dialysis. You've got to be on the dialysis. And when you're traveling, I know people who are businessmen, at least now you've got dialysis machine even in small towns, small villages. In those days, 25, 30 years ago, arranging a dialysis was not easy. If somebody is going to Africa, they have to call somewhere, book the dialysis, and it had to go. But we have got now new technology where the machine can be carried in your hand. This is an old slide where they're saying that it's not a handbag, but now dialysis machines are coming in suitcases, what we call suitcase kidney. Now the question is transplant better than dialysis? I think there is no question at all. Even Shakespeare said this, a man of my kidney. So magical cure of kidney failure is kidney transplantation. This is some of my success stories. This is a commissioner of police who had kidney transplant from Lagos, and within a month, he was back to action. Now, one other question, is there an age limit for transplantation? Can a child have transplant? Now, this girl from Malaysia, this girl, only 5 years old, this after transplantation, this was done in 1993. Now she's a young girl, married and settled well, 30 years down the line. But age is not a problem. Again, old age. Can an old man donate to a young person? This is an old man, 80 plus old man, donated kidney to his grandson. So these are some of the things which you should know. With a transplant, it is possible to have normal married life. This is one of my transplant patients with a child. So it's possible, but there's high risk pregnancy, it's possible. This again, another transplant patient of mine with twin girls. So this again, these are all some of the stories, success stories, which makes a nephrologist like me proud and happy because we're able to give them normal life, to lead a normal life. Now this again, a man, an Islamic scholar from Nigeria, after transplant, he got 4 wives and produced 8 children. And this is his first wife with his 4 children. So he came to see me a couple of months ago. He's doing well. So it's possible to have normal life. Now the problem with transplant, we come to the interesting aspect, which is, I think also everybody, I need your help also. There are a lot of ethical and legal issues. Every other day you read in the newspaper, kidney scam, Apollo kidney scam, this kidney scam, kidney stolen. Is this true? Is this occurring? Now, this is actually a picture, if possible, you should see, Tales of Organ Trade. The producer actually went with the idea that selling organ is wrong. And slowly, when she did the story, she realized that organ sale or some sort of compensation is not going to solve the problem. You have to look at it in a different angle. Your mindset has to change, and that's possible only when you think in a different way. In 1995, Bangalore, and those of you who are silver surfers would know, if you had been in Bangalore in 1995, there is so-called big kidney scam. Headlines were there. Thousands of villagers from Tamil Nadu came to Bangalore, and their kidneys were stolen and exported to Saudi Arabia. This was the story. Headlines everywhere. Bangalore was known not for anything else, not for software, known for kidney stealing. Is that true? No. So I was part in the eye of the storm. And this is my colleague, Dr. Balal, who is my chairman, an eminent nephrologist. At that point of time, we were trying to tell the commissioner of police, kidney cannot be stolen, and thousands of kidneys were not stolen, but that didn't have any effect. The media went gung-ho. Fortunately, we didn't have 24-hour TV channels, so we were safe. But to that extent, I must tell you on a personal level, my own son in school, they shaved his head and painted on his head, kidney thief's son. So we have gone through as nephrologists a lot of problems. It's not easy to be a nephrologist even now. There is a stigma attached. At that point of time, I know my colleague nephrologist wanted to get married. They couldn't get married because the girl's father would say, oh, he's a kidney thief. It was bad, so bad. The stigma was so bad. Slowly down the line, it has changed. But the kidney scams still continue. Now, we are trying all the time to be with the police, trying to tell them how we could help in helping to prevent the kidney scam. So based on the Bangalore 95 episode, the government of India passed an act called the Human Organ Transplant Act. This act started regulating kidney transplant. It said, basically, there cannot be a commercial transaction for kidney donation. You cannot buy, you cannot sell a kidney. And it changed the definition of death. Before 95, death could be certified only when the heart stopped. But now, we can certify death even with the heart beating when the brain is dead. So we call that brain death. Once we certify brain death, the organs can be taken for donation. That's how the concept of cadaver donation or diseased organ donation came in. Now it's 25 years since the law has come in, and slowly we are picking up. We are not still reached the stage of Western countries. Now, if you do a Google search on kidney transplant and the legal issues, majority of the cases will be in some form. In fact, either I have filed a case on somebody or somebody has filed a case on us. So kidney transplant is highly legal. A lot of legal issues are involved. And every other day, if you see, you will have headlines like this. It just keeps coming now. And now, when you look at transplant laws, close relatives can donate kidney. When you say close relatives, who is close relative? As per the Income Tax Act, an uncle can give money. A father-in-law can give money without gift tax because they are close relative. The income tax law, close relative, is different from the Organ Transplant Act. A father-in-law cannot give kidney to the son-in-law without clearance from the government. Before 3-4 years ago, This picture was taken in 96, where a grandfather wanted to donate to kidney to grandson. This was illegal, without government clearance. And when we approached the government did not give clearance to the grandfather. They said we cannot give. And this grandfather went to the court and argued the case himself. Unfortunately, we had a good judge who gave the verdict. With a court order, we did the transplant. Grandfather was 80 plus when he donated, and he died after 15 years. The boy is still doing well after 30 years of transplant. Now, there is always a shortage of organs, whatever way you do, because I told you, diabetes runs in families. When it runs in families, a diabetic person cannot donate kidney to the next of kin. And as per, if you look at the chronologically, my grandfather had 18 children. My father, only 2 children. I have 3 children. So the family units are coming down. So you're not going to have that many siblings to donate kidney. So what do we do? So we in Singapore, actually, we said that you should, what to do, you must do is ease the organ donation some way. Anybody can donate to anybody as long they know that they are donating out of free will, and some sort of compensation is needed. Even if it's not a sale, we have got to give some sort of compensation. That's why we coined the term organ sale, to buy or let die. It's a very controversial topic. It's a topic which needs discussion, whether we should legalize prostitution. The next question is that if we legalize organ sale, legalize prostitution. Is it ethical? The question, I cannot answer this. The society has answered. Now, this is another interesting thing which occurred in my career, is this man on the screen had kidney failure, and the only donor available for him was his younger brother, who had 100% match, and he had a widowed mother whom he was supporting, and this brother was deaf and dumb. He cannot give consent. Now, should we take the kidney? Is it ethical? We went on a debate. We argued around the clock. We took a lot of opinions. Finally, again, we went to the court. And again, this court judge was like Solomon. His argument is very simple. He said, if this man doesn't have a transplant, he is the only breadwinner. If he doesn't have a kidney transplant, he will die. If he dies, automatically the mother and the younger brother also will die. So to protect this deaf and dumb donor, I give permission for you to go ahead with the transplant. And it's amazing judgment. He looked at it in a different way. You can say that you exploited the donor. They have taken kidney from a person who cannot give consent, but the judge analyzed it in a different form. And I must say, it's 25 years now, they are both doing well. And I have gone through such sort of challenges, more than medical challenges, ethical challenges. And when we did this transplant, we were hitting headlines in various magazines. Indian organ donation goes without consent. All these sort of things come in. Now, a country like India, we cannot afford to treat kidney failure free. You may have Ayushman Bharat, you may have anything. Look at these figures in 1998 in United States. In 30 years, it's actually doubled. Medicare is 12 billion. Now, if you look at the treatment cost in India, I can't even put the numbers. It is going to be billions of dollars. Whether we can afford, a country like India can afford treatment of kidney failure free of cost or by insurance, it's a difficult question. So I always quote my beloved guru. He's a controversial man. Many people like him, not like him, but he's my guru. I am what I am because of Padma Bhushan, Padma Vibhushan, I must say. He taught me a lot of things. I was a pet student. I worked with him for many years. And he coined the term, swasthascha swastha rakshitam, keep the well healthy. That means prevention is the key. I make money on dialysis and transplant, but still, my key message is you've got to prevent kidney disease. How do you prevent kidney disease? So you've got to learn from Africa. This is a photograph taken many years ago when I went to Africa. If you look at the African Maasai tribes, they are very healthy. One of the reasons why they are healthy is they don't eat much salt. They are very active. And their diet is very clear, and they do a lot of exercise. I think salt is the villain. Please understand, we have got to reduce our salt consumption. Important. In fact, I have a colleague in Chennai, Dr. Rajendra Vichandra. He says, like, chini kam, namak kam, ek chamcha namak kam. That is his slogan. He keeps promoting that. I think if you can reduce your salt straight away by 50%, you will save a lot of lives, and kidney failure also can be prevented. I think salt is the key to restrict. Now, look at our evolution, how we started out like this, and over the years, because of fast foods, because of so-called Western civilization, McDonald's, we have become like this. And that is one of the reasons why we are having what is called lifestyle diseases. Now, there is a theory called thrifty gene. I don't know how many of you know. Down the years, our forefathers went through famine. So your gene always wants to conserve energy. Even when there is plenty of food, your genes think that you're starving. That is the reason why, especially Indians, Asians, we have high level of obesity and diabetes. That is the concept now. Because our forefathers, our genes, earlier genes thought we have no food, your body started conserving energy, and now we have abundance of food and obesity is coming. Now, one other important thing is smoking. I think there's no question at all. Olden days, when we were students, the Marlboro man was famous. Everybody wanted to impress, every man wanted to impress a girl by being a Marlboro man. Now, this Marlboro man himself had cancer because of smoking and died. Now, smoking is very dangerous. So, in the prevention of kidney disease, smoking is definitely no. One other thing which I keep noting is painkillers. Please understand, over-the-counter painkillers, except paracetamol, all painkillers will kill the kidney. Please understand. Please be careful when you take painkillers. Now, what is the future of kidney failure? Now, I talked of organ shortage, organ donation. Can we actually grow kidney in the lab? There are some research now. They are able to clone the kidney and grow the kidney. Maybe down the line, we can have kidneys getting printed. One other way is, can we take organs from animals, xenotransplantation? I know Menaka Gandhi will come after me, and I may be in danger of human rights or animal rights activity, but there are experiments going on where they've injected human genes into pigs and into chimpanzees, and they've taken the organs called transgenic pigs. So down the line, that could come, that could save organ shortage. Printing of human kidneys is also coming in. 3D printers are printing with genes that could come 10, 15, 20 years down the line, I don't know. But what is important is, I told you about dialysis machine. I think that is where technology is becoming smaller and smaller. See this machine here. Actually, you can take this machine, dialysis machine, with you anywhere around the world. So look at this grandfather with his grandchild with the dialysis machine, the size of a small briefcase. So it's possible. Now, as a nephrologist, my aim is aim high in life. I want all my patients who come like this with no urine to pass a lot of urine. The patients come to me with no urine. They come with a lot of money. They go back with no money and a lot of urine, like the Chinese. So it's important now. Before I finish, I wanted to know who are all at risk of getting kidney failure. People who have got diabetes, and especially who are diabetic, who are having eye changes. If your vision is bad, please understand your kidney also may be getting damaged. In fact, a lot of kidney patients come to me from the eye specialist. They've got diabetic eye change. Simultaneously, the kidney is getting damaged. So anybody who got diabetes, please check your eyes, check your kidneys. High blood pressure. Anyone with high blood pressure, please get your kidneys checked. Family history of kidney disease. Your uncle, father, mother, anybody has got kidney problem, please check. Anybody above the age of old age, the definition is 60, I would say, please get your kidneys checked, because as you age, the kidney also ages. Now, what are the symptoms of kidney failure? There are very many, but common symptoms are somebody is feeling nausea, vomiting, feeling tired, loss of appetite, swelling around the ankle, or what we call, you get up in the morning, swelling around the face. We call it puffiness of face. Abnormal urine output. Please understand, passing less urine, more urine. A lot of people think that the moment I tell them you got kidney failure, you need dialysis, they'll tell me, sir, I'm passing a lot of urine. More urine also is not good, because you must understand, in the kidney physiology, your kidneys filter 200 liters of fluid every day. 197 liters get reabsorbed. Only 3 liters comes out of urine. So if there is even 10% damage, the reabsorption can get damaged. You'll have 10% less of reabsorption. You can get 10 liters of urine. So anybody passing less urine, more urine also could have kidney failure. Persistent itching, I told you about mosquito bite and advanced kidney failure. Breathing difficulty, difficulty in sleeping. There are many causes. Please don't get scared. Insomnia could be so many things. You could have fought with your husband or wife and you could have insomnia. So many things is possible. So don't get carried away and don't get scared. Blood in the urine, painful urination, foamy urine, passing stones in the urine, less urine, more urine, Nocturia, getting up in the night, passing more urine. See, I told you about prostate symptoms. There, what happens is you get up many times, not because of the quantity of urine, it is just the frequency. So there is a difference between frequency and quantity. So please understand this is a symptom. Now, before I end, I always end with my favorite slide. I love you with all my kidney. You keep saying I love you with my heart, but you can't donate your heart to your girlfriend, boyfriend, husband, wife, but you can donate your kidney. So that's important. Now, I would like to end by quoting my favorite mythologist. Who sees it all? Varuna has 1,000 eyes, Indra 100, you and I only 2. So I have talked to you as a nephrologist with 2 eyes. My own impression in the last 35 years, I finished my nephrology in 1985. I have been in Bangalore as a nephrologist for the last 35 years. My own analysis, I have given you a bird's eye view of what I think you should know about kidneys. I'm ready to answer whatever questions you have on kidney, and we'll see how it goes. Sorry for being fast in my talk. That's the way I function, unfortunately. Thank you.
Thank you so much, Doctor.
It was wonderful.
That was a very informative session. Lots of information download happening with your session, and I'm sure everyone has a whole lot of questions to ask you. I'm going to start with a few questions I got beforehand.
Sure, go ahead. Shoot.
Bopaya basically says that his relative has an adult who has grade 3 kidney damage caused by lithium and metabolic syndrome. The disability does not allow for exercise and other behavior modifications. How best does one approach this problem?
See, if his patient has been on lithium, that means he must be on some sort of psychiatric medicine. That's where normal lithium is given for psychological support. Maybe we'll have to change that and talk to them and see anything else is done. When you say stage 3, it also depends on the age of the person and what are the symptoms. Apart from being stage 3, the stage 3 is a lab sort of analysis. Unfortunately, when we 25, 30 years ago, when we classified kidney failure, it was mild, moderate, and severe. Now, the Americans have based the stages based on lab parameters. Stage 1, stage 2. That's why in America, 10% of all Americans have got kidney failure, stage 1. So we don't accept it. As an old-time nephrologist, I don't accept these stages because unless you got some symptoms really. So this person who's got this lithium toxicity may need supplementation to find out how bad the damage has occurred. We need some more history on that. And how old is the person? Any idea? Can they give some details? Or they can do it to me in private if they want.
They haven't mentioned the age. No mention of the age.
No, but the lithium is known to cause kidney damage, and there are alternate medicines where, because if that is the cause, that has to be stopped and go for alternate medicines. But then they have to balance it because it's a good drug from the psychological point of view. So they have to balance which is worse, that's the way it is. So they have to work with the nephrologist and their primary doctor also. Okay.
Thanks for that, Doctor. Dr. Rama asks, as the process of dialysis is expensive and a lifelong one, how do the poorer sections of society manage this? Are there any preventive measures? Is it reversible? And are there any specific insurance packages specifically designed for dialysis?
I think that's a question which we keep talking regularly. Once you have permanent kidney failure, there is no way the dialysis can be stopped. So it has to go lifelong or they go for a transplant. Now, what happens is poor patients, now at least with the new Ayushman Bharat, it is being covered now. And the cost of dialysis is covered by the government. How long it will go on, we don't know, because even in the United States, they are not able to treat everybody with that sort of scenario. The cost again varies from center to center. There are a lot of charitable units. Now, I know that there is a Karnataka Marwadi Youth Federation, and through the Ranka Builders, they are doing dialysis at the cost of 500 rupees, and they are subsidizing. But they all run full. That's the problem. The government centers run full. So it's not easy, but there are some ways where we can subsidize. But if somebody, poor person, is going for a kidney transplant, then there are institutions which will support you for dialysis for a couple of months and support you for transplantation. So our suggestion is anybody who can go for a quick transplant, that's the cheapest treatment actually. Even though after transplant, the costs of medicines are high, overall, the quality of life is better with the transplant. So we would suggest more go for transplant. But slowly the Ayushman Bharat is going to cover more people on dialysis. But how long it will last, how much we can do, we don't know. So the key is prevention. Again, prevention, as I said, salt restriction, avoiding painkillers, no smoking, exercise. All these are very important. And early detection. I think early detection of kidney and many of the kidney problems, if we detect early, can be treated also. It's important.
And in terms of transplant, doctor, how easy is it to find a donor? I mean, that entire process itself can be quite challenging. And how much does a transplant cost?
The transplant we have to do with a donor. Now, when you talk of donor, the donor comes from a live donor, somebody who is live donating, or it comes from what is called brain dead cadaver donor. We don't use the word cadaver, we say diseased donor. Please understand, when you say diseased donor, it is not any dead person. In fact, a lot of people come and tell me, so many dead bodies are lying, why can't you take kidney? It's not like that. For a kidney transplant or a liver transplant, we need what is called brain dead heart beating donors. Most of the time, it has to be a head injury. As somebody is going on a motorcycle or scooter, young man dying. In fact, I remember many years ago, I was in a dialysis unit in New York on a Christmas Eve, and some of the people are actually praying that some young man gets drunk and dies. I mean, it may look cruel, but that is the way they were actually telling me. The 50-year-old gentleman was saying, I'm actually praying, doctor, some young man will go and die with a head injury. That is the way it was. That comes from so-called cadaver donors. Now, what is important also is live donors, people who are wanting to donate kidney. Now, I want to donate kidney to somebody who is not my relative. That should be made easy. Not for sale, but it should be easy. Now, I know a lot of so-called, these are called altruistic donors. These are donors who donate to a stranger without taking money. That numbers are less, but even those altruistic donors, please understand, will need some support. Suppose I want to donate to an ex-person. I am going through a major surgery for a month. I cannot work for some time. I need compensation in some form. Why can't I be given like a Padma Shri one medal? With the medal, I get free airfare, I get income tax rebate, I get something. So those are things which the government can do, which is ethical. It is not sale. So this is what we have been talking round the clock. We're going on telling the government, but nobody wants to take this head on except Iran, which is legalized payment to the donor. The government itself pays money to somebody who donates, whether related or unrelated, the government will give so much money. So our Indian government also can help the donors in giving some sort of insurance, some benefit. So we'll have more live donors. Then cadaver donors also, people who accept. Now I accept for some relative to my parent or somebody who's donating kidney or organ. I get something special. Suppose I get kidney failure, I'm up in the waiting list. I get some rebate. So there should be incentive there also. Just because somebody has donated out of love, their loved one, a father, a child, accepted a child to donate an organ, they must be recognized in some form. They must be treated like a hero, a war hero, a soldier, and then things may change. It's important. But it's coming. I mean, 25 years ago, we never thought we'll have cadaver transplant. Now at least 5 to 10% of all our transplants are in some form of cadaver. Also, I think religious leaders have talked. I remember a case where the family was ready to donate kidney, but one aunt said it is Amavasya and you can't take kidneys out. And the whole scenario, we lost the person, we couldn't take the kidneys. So these are some superstitions which we have removed. And this is possible by leaders. It's also possible by celebrities. Like we have Anil Kumble as the brand ambassador. We have Aishwarya Rai for eye donation. I think these celebrities talking is important. And like the silver surfers, I know so many of you are doing, I mean, you've got your celebrities yourself, and you talk to 10 people on organ donation, it would make sense. I think it's important.
100% agree with you. Okay, moving on. Uma Pai has a question. She says she's a diabetic and cancer survivor for almost 20 years. Is there anything in particular one has to take care of to protect their kidneys in this situation? Kidney function test, is it necessary? One second, sorry. Kidney function test, is it necessary to keep repeating it? And if so, at what intervals? Do the kidneys get affected after cancer treatment, Rhizode? And she takes Tazloc 20 IP 20 mg tablet after breakfast and Rhizodeg insulin 8 units before breakfast, before dinner, each day along with some calcium. Just giving you a
first of all, pronouns to her, Uma, for she's a cancer survivor, cancer conqueror, I would say. It is important because you're a diabetic and you're on also because you have this Tazloc must be for blood pressure. I think I would say at least every 6 months, please get your kidney function checked. It's important, get your blood pressure checked. if you have already gone through chemotherapy and now you're not on any chemotherapy, I don't think you'll have any kidney damage, because only during the phase of chemotherapy, some of those drugs cause kidney damage. Otherwise, when you're already had the chemotherapy now, there's no problem. Definitely, you should keep your sugars under control, your salt under check. Definitely doing some yoga or some sort of meditation to relax. Exercise, physical exercise is important. I don't know whether you're overweight, whether weight control is important. Avoiding.
She's very tiny. She's not overweight.
Oh, then good. That's good. Avoiding painkillers, over-the-counter medicine also is important. I can see her. She looks quite. Hi, Uma. I can see you on the top of the screen. So painkillers, avoiding painkillers also important, except paracetamol. But I would say get your eyes checked. That is a clue actually. We have never seen anybody having kidney damage due to diabetes without the eye getting affected first. So get your eyes checked every 6 months, 1 year, and get your urine exam and the kidney function or kidney number at least once in 6 months, I would say. That's why I would say once in 6 months is a decent way of getting screened. Okay?
Okay. Thank you, doctor. Thank you.
Thank you, Uma.
Thank you.
The next question is from Mavis. She says, what precaution should a person who has undergone RCC surgery of one kidney, that is the right kidney, need to take? What should his creatinine level be? What is the upper limit for it? And how can he keep the level low? And how can potassium be controlled with diet? What fruits can be safely had? What greens and vegetables? And can fish in general be had by an RCC patient? Too many questions? You want me to break it down?
No, before the RCC means they would have removed one kidney or part of the kidney. Was one kidney removed because of RCC? That's the question. And yes, as I mentioned earlier, even if you have only one kidney and if a kidney function is normal, there's not much to worry. So basically, we are able to do transplant because somebody is able to give one kidney. So question is, when they remove the kidney, what is the kidney function? And how old is the person now? Can I have an idea? What is the age?
76. He's 76.
76. And what is the creatinine now?
1.45.
1 point. So it is little on, see, for 76, 1.45, little on the higher side, I would say. So you have to be careful. And so what would you do? I would say that fish is definitely good. In my opinion, I'm a vegetarian, but there's a lot of evidence to show that fish actually helps kidneys. In fact, some of the kidney diseases, we actually give fish oil. People who eat fish, I tell them eat a lot of fish. People who are vegetarian, we actually extract the fish oil and put it in a capsule and give it. So fish is good for the kidney and the heart. There's no question at all. Avoiding painkillers, mainly something like diclofenac, ibuprofen, etc., except paracetamol. Salt restriction, keeping your weight under control, and smiling, and be happy. If you smile, the kidney smiles. That's my opinion. So don't keep worrying. 1.4 with one kidney, 76, you're doing well. That's my opinion. But keep checking your values once in 6 months and keep seeing a physician and nephrologist. That's my advice. Okay.
Fruit, I wanted to know.
Fruit, see, that's the question. So what is your potassium now? If the potassium is not,
it's a wee bit high, not much high.
See, if it is less than 5, so you can be a little liberal. See, most of the fruits contain potassium. See, all dry fruits contain potassium. Nuts contain potassium. Another mistake which people do is when I say don't take salt, they'll take something called alternate salt or rock salt. That actually contains potassium chloride. In fact, rock salt is a killer. If you tell your grandmother you got kidney problem, she'll say drink Elnir. Elnir is a definite way. If somebody has, in my teacher, Dr. Shastri would jokingly say, if somebody has got kidney failure and no money, buy him 2 Elnir and give. Because the fellow will die. Because Elnir has got so much potassium. So Elnir is bad if you've got kidney problem. So in your diet, if the potassium is less than 5 or less than 4.5, you can be liberal. But I think what are the drugs you're on for blood pressure? Have you got any high blood pressure? Because some of these medicine.
Amlodipine.
Amlodipine is okay.
Metoprolol.
Metoprolol can increase the potassium a little bit. Amlodipine is okay. It will cause swelling of feet. That is no problem. But by and large, avoid dry fruits and nuts, I would say. And don't take alternate salt like rock salt or Saindra Lavana, because that can increase the potassium.
Ramipril also.
Ramipril, no. That actually increases potassium. Ramipril increases, but it's a good drug. It protects the kidney. So you will have to work with your dietitian and preferably a nephrologist and adjust. So So it's not easy. I can tell you don't take this and all that. But by and large, I know most of the fruits contain potassium. There is no fruit, they will say take papaya or pineapple, apple, all of them contain some potassium. So you have to watch the potassium because more than salt, potassium above 7 can stop the heart. That's the problem we have. That's the worry we have. So you have to be careful with the potassium. Okay.
Thank you, Doctor.
Ramipril is one drug which could increase the potassium. We may have to, if the potassium goes up, we may have to stop it or adjust the dose. And it can also increase the creatinine debit, Ramipril. Okay.
Thank you, Doctor.
So maybe that's something you need to raise with your own doctors, Mavis. Okay, moving on, we have a question from Sushil Basin. He says, do the kidneys get affected by long endurance activity? If yes, then what should we do to reduce the effect? Does protein affect kidneys? How much protein should one have if he is a kidney patient?
It's a good question. See, if somebody has already got a kidney damage, and if they're doing some marathon exercise or marathon sudden running, can cause kidney failure. If somebody is doing gradually, walking every day, you've been walking an hour every day, you can continue to walk. It's not a problem. Only acute exercise, like marathon runner, is known in the Boston Marathon runners, you run a lot, you can have what is called kidney failure. It can worsen the kidney failure. Now, if you've got normal kidneys, protein, there's no protein restriction. But if somebody's got a kidney problem, definitely protein restriction is needed, but not in the Indian context. If you are a vegetarian, there's no need for protein restriction, in my experience. If you do too much of protein restriction, your body protein will start breaking. What is recommended by the Americans for protein restriction, because the Americans take in a breakfast, if you've seen American, you see what is called the trucker's breakfast. The morning, that steak itself is 80 grams. We don't eat that sort of high protein diet in India. So in vegetarian, if you're taking some idli or some dal, it's not much. 61 gram per kg per day, roughly, is allowed in India, even with a person with kidney problem. That's the thing. If suppose you've got normal kidneys, now what I'm seeing is actually, which is worrying actually, is a lot of these youngsters are taking creatine to bodybuilding. They want to become like Salman Khan or Hrithik Roshan. My own son was doing it. I had a tough time asking him not to take the day protein, because of recently we are seeing youngsters coming with kidney problem. They're taking 200, 150 grams of protein, high protein, doing exercise, which in my opinion, gymming too much, it's a controversial topic. A lot of this so-called health expert gym, they argue with me, but I've discussed with Dr. Zadev, the authority on protein and kidney diet. Too much protein of that level is not needed. It could affect the kidney, especially if you've got a family history of kidney, you've got diabetes, that sort of thing, So I would be careful.
All right. The next question is from Sushil again, Sushil Basin. He says, can a person having only one kidney genetically get a second kidney transplanted?
So you got one kidney, which is working well. Why do you want to put? There's no need. Nobody will put because doing a transplant itself is difficult. And when you do transplant, you're on so many medications which can cause problems. There's no need. If you got one kidney, like Vajpayee had only one kidney. Please understand, he was the prime minister of the country, and he did a good job. So a lot of people are born with one kidney. As I said, 1 in 1,000 is born with one kidney. Having one kidney is not an issue, because especially if you're born with one kidney, over the time the kidney becomes big. Even when you donate a kidney, when you're young, 30, 40 years old, you donate a kidney, in 5, 10 years, the kidney will increase in size, called compensatory hypertrophy, kidney increase. So just having one kidney with normal kidney function, there is nothing to worry. There's no need to put another kidney just like a stepney, not needed. It's not worth it. Okay.
Good news. Okay. Colonel Arun Malhotra asks, can a diabetic elder donate his kidney to another?
Colonel Sir, pranam to you. You're a Fauji, like I also come from a Fauji family. My father-in-law was a major in the Army Medical Corps. So we are proud to be Faujis. Now, the question is a very important question, because of late we are seeing quite a few diabetic parents wanting to donate to their children. The father is 70, diabetic, the son is 45. Earlier days, I was not taking at all. I was not taking any diabetic. Once you are diabetic, it's a contraindication. We would not take the kidney. But now there is some literature to say somebody who's 70 who's diabetic with no other end organ damage. That is, diabetes has not caused any problem. They are not on insulin. Their eye vision is normal, heart is normal, there's no neuropathy. Then you could consider in selected cases such person to donate. Because the theory is somebody who's 70 who donates a kidney, By the time they get kidney failure, they will be 100. So it's okay. It is not somebody who's 20. So I have a problem in children donating to parents. I have quite a few. In fact, recently also I had a young girl. She was 25. She wanted to donate to her mother 50. And she was not married. And she was engaged to somebody. And the person who was engaged, he said, if you donate kidney, I will not marry you. She said, I don't care. I want my mother. And she donated. But actually, in my mind, I was going through, not as a doctor. I was thinking, if she is my daughter, if I have kidney failure, will I take? As a doctor, legally, she was allowed. Medically speaking, she is allowed to donate kidney. We took and she's doing well. But as a doctor, I always function, what would I do if it is of my family member? I always think like that. So I became a better doctor when my 4-month-old son had pneumonia and nearly died. I understood how it is, and then I myself had a heart attack. I became a better doctor. So as a patient, I understand. Like when my patient used to complain after kidney transplant, there's this, doctor, I am not able to go to the motion, constipation. I would say, I have given you kidney transplant, your life is saved, what are you bothered? When I had a heart attack, the first thing which occurred to my mind, I didn't bother about my heart. I told my cardiologist, I don't mind dying, please solve my constipation problem. Because that is the most important at that point of time. So these things you realize when you become a patient. So in my mind, these are ethical issues, like a young girl, would she donate kidney? Then I had another case where the daughter wanted to donate kidney to the father, and the daughter was pregnant. At that point, we cannot take the kidney. So I said, you are pregnant? No. She said, I will abort and give kidney. My father is important. I said, no. Then what happened? 3 months down the line, she went to some other center. She got abortion first and donated. I didn't do the transplant, but I came to know that she was so insistent. She didn't tell anybody. She went to private center, got abortion, then donated to the father. So these are questions, ethical questions, which no other specialty will have. Either cancer specialist or heart specialist will ever go through. Transplant will only feel so many emotions, so many ethics, and so much philosophy comes in. That's why my guru, Homer Smith, is very correct, very rightly said, kidneys not only make urine, but they make stuff of philosophy. So I become a philosopher in that sense.
Thank you. Yeah, that answers.
Thank you, sir.
Moving on to Krishna Kumar, what are the symptoms to detect kidney failure at initial stage? I know you've covered this, but if you could just quickly run us through it one more time so everyone remembers it as well.
I didn't get, what are the symptoms, no?
To detect kidney failure in the initial stage.
What I would say is, somebody who's got high blood pressure, please get your kidneys checked. You get up in the morning, you see swelling around your face. It could be because your husband or wife hit you, it could swelling, but nevertheless, the swelling around the face is one of the early symptoms. Swelling in the feet, passing less urine, passing more urine, foamy urine, blood in the urine, passing stones in the urine, family history of kidney disease, diabetes, blood pressure. These are definite things. And somebody who got diabetes and eye change, definitely get your kidneys checked. This is very important. These are the warning signs or something I would say to look for and get your kidneys checked.
Okay. The next question is from G. Bulchand. He says, if creatinine, PSA are kept under check with appropriate medicine, is there a chance of kidney failure over a course of time? In general, what is the success rate of kidney transplant? So he's got these two questions.
I didn't get the first portion. What did he say about PSA? What is it?
If creatinine and PSA are kept in check with appropriate medicine, is there a chance of kidney failure over a course of time?
See, now the creatinine is the, as I said, is the kidney number, is the marker of kidney function. So if the creatinine is normal and the urine there is no protein, then more or less you can say that your kidneys are normal, you need not get worried. Now, coming to success of kidney transplant, we talk of success in the range of 5, 10, 15, 20 years. It's like cancer. When you talk of cancer also we talk 5, 10, 15, same way. Now, if I do 100 transplants today, at the end of 5 years, 90% will be doing well. The kidneys are working. I'm not saying they're dying. The 90% will be doing well. At the end of 10 years, 70 are doing well. At the end of 20 years, 50 are doing well. Now, if you don't do transplant, if you take 100 people on dialysis, at the end of 1 year itself, at the end of 10 years, 90 are dead, only 10% are alive. Meaning, longer you're on dialysis, chance of dying are high. So a transplant, my oldest transplant I started in '87 is still going strong. 32 years now. He came at the age of 30. Now he's 62. He's become a grandfather. His son is settled, studying in working in US. I have many success stories later. I have also stories where we have done the transplant and the same day the kidney has been taken and we have thrown it in the dustbin. Because the problem with transplant is when you take a kidney from somebody else, either a cadaver or a relative, the kidney is a foreign to your body. Your immune system will act against it. So this is called rejection. Many times the body will reject on the table. As you do the transplant, the kidney will become black. So we have to take the kidney and throw it out. That is the problem in India. In India, the kidney comes from a loud person, either a husband, wife, father, mother. And then they would have spent 10 lakhs, 7 lakhs, whatever. And then I tell them that kidney is gone, I've thrown in the dustbin. These are the people who get angry with the hospital. In fact, they accuse us of saying, you're taking the kidney and sold it. Because one is, they have spent so much money. They have sold the whole house and related person has donated. They cannot accept the kidney not working. In the Western world, story is different. The kidney comes from a dead person. There's no relation. And the entire thing is paid by the government. They have no attachment to the kidney. So scenario here in India is a lot different from practice in the other world. So coming to the success of transplant, again, you must look at the success of not doing a transplant. Please understand. If I put it like this, I don't say 10% failure. If I say out of 100, 10 will die, nobody will come. But if I say out of 100, 90 are doing well, it is the way we put it. It is the success story. And I showed you a lot of success stories, but there are also failure stories. If I say there is no failure, if any transplant nephrologist says he has got 100% success, he is bluffing, or he has done only one transplant and that one transplant is success. It's not possible. Nobody can have that sort of success. It's not possible.
So doctor,
but it's also possible to have more transplants. Please understand. If one kidney goes, one transplant goes, you can have second, third. I have had quite a few people having had third transplant. Even last month, I did for one patient, CEO of a company, third transplant. His wife donated. First transplant was his unrelated transplant. Second was his father who donated. Third was his wife. Last 30 years. So, but for that, you need donor, you need money. So this is not possible. And I know from CMC Vellore, where I was trained, somebody who had 7 transplants. It's possible. And the 7th transplant, the patient died not because of kidney failure. He was trying to change a stepney in a car and he was sitting on the road and he got hit by a truck and he died. That is a sad story.
So what are the parameters to find out, doctor?
Okay, uncle.
Sorry, I think someone unmuted. Doctor, you'll have to unmute yourself.
I've done it. Okay, go ahead, ma'am.
What are the parameters of finding a match? What are the parameters that one looks at to find a kidney match?
For a kidney donation?
Yes.
No, parameters for what? For kidney donation? What is?
Yes. Find a match for a transplant.
The most important match is a blood group match. We call it blood group compatible, medically fit, related donor. This is the ideal. Blood group compatible, medically fit, related donor. But then each can be expanded. Related donor again, maybe cousins, uncle, or a friend, because the law does not say a friend cannot donate. It only says no commercial transaction. A lot of people think unrelated transplant is illegal. No, a friend can donate to friend. I have got doctors who have donated doctors. I have got a Swamiji where one of his devotees has donated. It's possible. Like Sushma Swaraj, Arun Jaitley, they also had unrelated, so-called well-wishers donated. It's possible. Now, what is illegal is the commercial transaction. Now, even blood group, of late, we are doing something called against blood group. But again, this requires a lot of technology. The patient has to be prepared. Patient is admitted a week ahead. It costs more than the usual. You have to take out the antibodies. It's about the cost is double. So even that blood group, that is changed. Now, related, I've told you. Medically fit, again, we are taking people who got little diabetes or high blood pressure, elderly donor, we call extended donors because there is shortage of organ we are taking. All this is individual level. But by and large, ideal, it would be medically fit, blood group compatible, related donor. This is the ideal situation. Okay.
So we should all shortlist donors in our families, basically.
That's true. That's true. That comes in the mind, isn't it? That's true.
As a backup.
That is why I think that is the reason I'm saying that if you have some sort of altruistic donation. It's like you are able to donate blood. If kidney can be donated, anybody can donate anybody, make the laws easy, and even give some sort of compensation, open up the thing without actual exploitation. We can avoid exploitation actually.
True.
A person from the village or somebody, we need not steal kidneys or that sort of thing will not occur. If it is opened up and it's made easy. Why is this occurring so-called kidney scam? The patient is desperate. Somebody is dying. It's not tolerating dialysis. He's got money. He doesn't know what to do. And there's another place where somebody is dying because of poverty. He knows that if he donates kidney, he'll get some 5 lakhs. His whole loans will go. So, and there's a middleman who exploits the situation. So that is where the problem comes. The exploitation comes because it's not open. If it is transparent, things will be different. I mean, this is a very controversial topic, and it can go on and on. We can go on arguing this way or that way. But in my experience, I realized that what is ethics for me now, I can talk ethics to my patients, but when it comes to me, ethics will change. Simple thing like vaccination. I've had vaccination as a healthcare worker. Now, a lot of my relatives are calling me and saying, do something. I'm your uncle, use influence, put some influence and get vaccination done. So sometimes I keep on saying, okay, maybe my wife also, I must say she's working with me and bluff and get vaccination done. It keeps coming in my mind like that. So it is ethical, unethical. If it's easy for you to talk for ethics of others, but when it comes to you, things will change.
True. Okay, Murthy Vadapali says, what is the reversal plan for someone with primary symptoms?
What is the
Reversal plan for someone with primary symptoms?
primary symptom? I didn't understand. What is the primary symptom? I'm not able to get the question.
I guess primary symptoms of kidney failure. Is there a reversal plan, and what are the chances of reversing the condition?
No, that's the only way you see. If there is a permanent kidney failure, the only cure and way you can reverse the kidney failure by kidney transplantation. There's no other way. That's why we say magical cure for permanent kidney failure is kidney transplant. Otherwise, you're on dialysis, which will only solve only some portion. Then you have to take all these injections and other things. The permanent cure, magical cure for reversing kidney failure, permanent kidney failure is transplantation. But acute kidney failure, there are a lot of things where you can be on dialysis. You can treat them. There's something called glomerulonephritis, lupus nephritis. We can give drugs. In course of months, the kidney failure will reverse. And that period, you support them with dialysis, it's possible. So that story is different, acute. And that's where all these charlatans come in. You get homeopathy, Ayurvedic doctors who say, patient was in dialysis for many months, and I reversed the kidney failure. I have a lot of patients like that. In fact, I have patients from Bangladesh coming with ready for transplant, and I found out that they got acute problem, and they've given medicines and they've recovered, and they claim that I've got Allah's heart, and they come thinking that, and they send many more patients thinking that I can cure. No, it's not like that. Each case is different, But acute kidney failure is something which could be reversed. It's possible, not permanent or chronic kidney failure.
Okay, I'm going to go quickly through the other questions, doctor, because we're already at 7:30 now. Two people, Sri Mahalakshmi and Murthy, have asked, each one talking about the number of times they pass urine at night. One says 3 to 4 times and they are 65 years old, and the other is 5 to 6 times and they're 54 years old. Is that serious? Should they be concerned, or what's your take on it?
So see, if they have noticed that they are going, normally up to 2 times a night, going in the night is accepted. We don't consider as a problem. But if it is going more than 3 times and it's affecting their sleep, definitely they need to investigate, because it's a simple cause. It could be because they are not noticed that sugars are very high. If somebody has got high sugars, we had the diabetes. We call it polyuria. In fact, how do you diagnose diabetes olden days? Polyuria, that is passing more urine. Polydipsia, feeling more thirsty, and polyphagia, eating lots of. That is how diabetes was diagnosed. So you must rule out high sugars. Number 2, you can have an urine infection which can cause problem, or you can have some kidney problem in the dilution. So it's better that they get checked up if it's definitely affecting their sleep, and they've noticed this in the recent past. That's my advice.
Okay, thanks for that. Deepika Margo asks, if we reduce salt, won't sodium-potassium balance get upset? Sodium level would become less then.
It's a very good question, because basically Indian diet, we take more than 8 to 10, 12 grams of salt. What we need is 4 grams of salt, that's all per day. They've done a lot of research. The Western diet actually has even less than that. If you look at the Maasai tribe. So if you take less salt and more water, then that's what happened to the Boston Marathon runners. they were taking only water and not salt, and they were all having low sodium and dying. They were dropping dead. So the answer to this is up to 4 grams. If you can actually measure the salt, that is best. In fact, what we say is cook without salt, and then there is something called salt tablets, CMC yellow cells. Each tablet is 500 grams. So you use 3 or 4 or 5 tablets per day. You know how much salt you're adding, using. Don't add extra salt. Definitely chips, pickles don't take unless needed. So in Indian diet, it is very high salt. There's no question at all. Saying that even I take a lot of salt. I'm trying to cut down, but it's not easy. The chips or pickles, those are all very tempting. You feel like taking it. That's the story. And so I would suggest if you can measure your salt, start slowly reducing. In a week or 10 days, you will know. The I mean, there's no connection to the sodium directly. There's no problem on that. But definitely, there's no question of sodium loss if you're following this. The sodium loss thing comes if you're not able to take salt when you're unconscious or you're elderly, you're not taking enough. So that's the thing. But Indian diet, reducing salt, but by a few grams will not do any harm.
Good point, Doctor. 4 grams of salt per day is what you're saying.
4 to 5 grams a day. I would say if your blood pressure is very high, some people I put 2 grams, but 4 to 5 grams, if you can cut down, it's easy. But because if you measure actually what we are taking, we have done a study, average Indian diet is 10, 12 grams salt. That's the thing. Wow. And some of them even more.
Okay. Banu asks, what are kidney-friendly foods, vegetables and fruits? What foods to absolutely avoid?
See, if you don't have a kidney problem, I won't think anything to avoid. But if you've got a kidney problem, certain fruits and nuts and all have to be avoided because of the potassium issue. And there are certain, if you had a transplant, certain juices, like, what you call grapefruit, those sort of juices can affect your blood levels. So we have got to be careful of that. Certain Chinese herbs, those sort of things. But by and large, if the kidney is normal, there's not much of a restriction. I don't think you should restrict much in your diet, fruits or vegetables wise. I don't think so. But if you've got a kidney stone, too much of these vegetables could increase the kidney stone. So you'll have to consult your doctor because the oxalates get excreted when you take too much of this vegetables. So you have to be careful of that. Okay.
Great. Reshma says that she would like to know what the effects of chelation on kidneys are. I'm not sure what chelation is, but
effect of chilies?
No, chelation.
Chelation therapy, sir.
That again, see, I have no experience on that, but this chelation is done for various things. One is when the iron load is more. I don't know for what they do. I have no experience on that. What chelation are they talking of? Because I have no
can I speak, Dipti?
Yes.
Please, go ahead, ma.
Sir, it's for toxins removal, sir. So I've been on chelation session for around 12 sessions now. And I'm actually feeling a little weak and all that, but I'm taking medicines, Silborn, and constantly checking the creatinine levels and LFT done parallelly. So I'm just checking, like in a longer run, like will it affect or what exactly it would be?
Now, what is the chelation therapy? I mean, is it? I have not heard of it. That's what I'm asking. I myself don't know, to be honest. What do they do?
They actually they have actually a set of medicines that they send through IV treatment inside, sir. So like every week, there's a lot of vitamin B12 and other medicines also included in it.
And for what condition? For what condition is this, ma?
So basically, it is used for 2 treatments, sir. One they use for even cardiac artery blockages, and the other one, what I am going through, is for metal toxins. I had an issue where I was like induced with poisonous metals. So that's the treatment for removal of those poisons, like heavy metals, like arsenic and lead and all of those kind of things.
But is it done in a hospital or who does it? I mean, is it
it's in a hospital. Yeah, it's in a hospital.
It is an allopathy doctor or
yes,
Ayurvedic?
Yes. It's a no. It's a allopathy doctor. It's a cardiologist.
Okay, I'm very honest. I have not heard of it. I don't know. I think you have to teach me. I'm very honest. I myself I have no idea at all. I have not heard of this chelation therapy.
Okay,
and
sir.
Maybe I should read about it. I'm sorry.
Sir, I'm referred by Sujata auntie, Sujata Balkrishnan, your sister.
Oh, my sister. Okay.
Yeah. So I'll catch up with you later on this. Yeah.
We'll catch up. Thank you, dear.
Thank you, sir. Thank you, Dipti.
Yes, not at all. You're most welcome. So moving on, Bandana says, can a person with lupus and multiple complications donate an organ?
Can I?
Person
I'm
with
not able.
lupus and multiple complications donate an organ.
If somebody's got lupus and if they've got a kidney problem, they can't donate. If,
I speak.
normally, lupus itself, when you have lupus, your kidney is affected. Invariably, all patients with lupus will have 100% chance the kidney is involved. So if somebody's got active lupus disease, we will not take their kidney. That's contraindication.
May I speak? Me?
Sure,
Yes.
Vandana, go ahead.
Yeah, that's me. Lupus, so far the kidneys are all right, but the liver and the lungs are involved. There's interstitial fibrosis and there's compensated cirrhosis at the moment.
No, they want to donate a kidney?
No, any organ. I'm just asking, can I be an organ donor?
You can be not when you're alive. It's possible when you're passing away or somebody's brain dead. Then maybe depending on the kidneys may be taken if it is not affected. They do some biopsy, check with it's possible. It's possible like that.
Okay.
And definitely other organs like eye can be taken.
I can be taken. Yeah.
Cornea can be taken if there's actually cornea donation. There's very less of contraindication. It's not a lot of most of the time you can take that. It's easy to take also.
Okay. Okay. Thank you.
Thanks, Vandana. Thank you, doctor. Jesse asked, what's the age limit for kidney transplant? I think we've covered that. You said there's really no age limit. Even a 70-year-old can donate a kidney to a youngster. So we're going to move on. Usha Ramnath asked, how likely is a person with thyroid problem to have renal failure? Is there a correlation?
I'm not able to hear clearly, Deepthi. I don't know why.
Usha Ramnath, can you hear me now, doctor?
I can hear you.
Okay, so
Go ahead, ma.
ask if there is what is the correlation with thyroid problem and renal failure?
See, it's a good question. Actually, there's no direct connection, but there are certain conditions where it's called thyroiditis, like a lupus, it affects the thyroid and the kidney. It's not very common. And all people with kidney failure will have some thyroid hormone deficiency. Whenever you have kidney failure, the TSH will be different, thyroid levels will be low. We take the help of endocrinologists. There's something called parathyroid that also gets affected. But directly, there is no correlation between thyroid and kidney. Suppose somebody's got low thyroid or high thyroid, there's directly different effect. But there is an autoimmune condition where your own body reacts against the thyroid that could occasionally damage the kidney. But it's not very common. It's not common.
Great. Doctor, just 2-3 more questions and we'll wrap up this session. Bharti says, what does it mean if there is pain towards the end of passing urine? Is that early signs of UTI or what's your take on it?
Yes, I think definitely any pain, whether end of passing, beginning, should need investigated. Either it may be some sort of what we call, especially the lady, they will have something called urethritis. There's inflammation, infection. So they need to get a urine exam done first. That will tell you whether there's urine infection, and preferably be a gynecologist or a urologist to sort it out. It is not normal to have any pain during end of urination. It's not normal.
Okay. Does high uric acid indicate kidney dysfunction? This is from Nilima.
See, it's important. Any kidney failure, the uric acid will go up. Somebody who got chronic kidney disease, because the uric acid gets excreted by the kidney, level will go up. Similarly, if somebody has got high uric acid due to gout or something, that also can cause kidney damage. It is both ways. So somebody who's got high uric acid should get their kidneys checked and bring down the uric acid. Now there's a new theory that the high blood pressure which occurs in everybody is because of uric acid. In fact, uric acid is now the new villain in our metabolic disease. So somebody's got kidney failure, uric acid will go up. Somebody's uric acid is very high, they can damage the kidney. So it's important to get the kidneys checked. And I know people who got gout, the uric acid is high and they take some painkiller medicine, that also damages the kidney. So you must be careful with that. Okay.
Okay. Bharati goes on to share that she has scoliosis, 10,000 count, or is that 100,000 count? And the person who had pain during passing urine, she says she has scoliosis, 100,000 count, and she's taking homeopathic medicines for UTI. So
No, I didn't get. So you got 10,000 what urine infection, E. coli.
no. Bharti, would you like to speak?
Ask her. No? Bharti?
I don't see her. Okay, we'll move on because it's getting a bit late. So Sushil Basin says during marathon he takes 1 salt tablet to avoid cramps. Is it okay for a 6 to 7 hour running event? 1 salt tablet per hour.
That's it. No, 1 salt tablet won't do any harm, but whether it'll help the cramps, I don't know.
Depends on what.
But is he, if he's a regular runner, then
He is a regular runner, yes.
then so 1 salt tablet shouldn't do any harm. I mean, it won't do any harm.
But he
Shouldn't do any harm. If it's helping him, no, I have no issue.
No, it does help, doctor. I know from personal experience also. When I did the guide running for visually impaired children, 6 of them, they ran the ultra marathon from Mysore, Bangalore, and also Mumbai, Pune. So we were also advised to have the salt tablets for those children.
I think salt tablet is over. My only concern is not taking salt and drinking only water. That is more dangerous.
Yeah, no.
Salt taking when you're running or when you're sweating, you take some salt. Electrolyte replacement is not a problem. In fact, that's accepted. Drinking only plain water after marathon is not accepted. But taking some sort of electrolyte balance, it's accepted. In fact,
energized drinks.
Energy drink is okay.
Doctor, can I ask?
Thank you.
Can I
a couple of questions here.
Go ahead, Sushil.
Oh, Sushil, go ahead.
Actually, my question was that when I run, I get a lot of salt on my face, out of body, and on my legs. So, as advised by some of the coaches, I take 1 salt tablet, which has salt and other electrolytes combination. Every hour, 1 tablet.
So you can take any of this electrolyte supplements, Kool-Aid or whatever, Gatorade, it's accepted. Don't take only plain water. That's my suggestion.
Yes.
Only water alone is not advisable. Okay.
But when I do even go more longer than marathon, then I don't take any salt and I take only plain water.
That is, I think, you should be careful of that. That's what is my worry. That will bring down. See, when you don't take salt and take only water, the sodium level is called dilutional hyponatremia. Sodium level comes down, and that could be dangerous, in my opinion.
That is normally when it is a 3-4 days event and we are taking normal salt in our food.
Then it's okay. See, if it's the chronic, I mean, it's a slow event, that's not a problem. Okay.
Okay. Thank you.
Okay. One quick question. Does kidney problem lead to continuous back pain? This is Jeru Irani.
Yes. See, kidney, there are 2 things. One is kidney problem can lead to a lot of calcium problem. Bone problem, it is known. There is also another condition called multiple myeloma, which starts off with back pain and kidney failure. Multiple myeloma is like a blood cancer sort of thing, which occurs in elderly people. And I've seen that. They have back pain and then kidney failure. It's because of a condition called multiple myeloma. You have to rule out that they have a fracture of the spine, and it is possible. Plain kidney failure is not treated because of the calcium levels are low and parathormone levels are high. You can have back pain. It's known. And the other story also, as I said, I've seen rarely elderly people with kidney failure because of multiple myeloma. It's like a blood cancer, which can cause back pain and kidney failure.
Okay.
Excuse me, what is fatty liver?
Jaya, I think, has a question. Jaya Kalyanram.
Yes, madam. Yes, Jaya.
Can I ask you the question?
Please.
In 2018, I was diagnosed with nephrotic syndrome. I was treated at Manipal Hospital. I healed. The last course of treatment I had was in February 2020. I have been feeling good, but I want to know if nephrotic syndrome will, is there a possibility of it recurring?
No, but did you have a kidney biopsy?
Yes, I did.
And what was again, depends on what was the biopsy condition. Something called minimal change, or FSGS.
Oh, minimal change.
If it is a minimal change, by and large, it should be all right. I think you're cured. And who was the nephrologist there? I got brilliant colleagues there in Manipal. Who was taking care of you?
Dr. Kishore Babu.
He's a good man. He's a very knowledgeable guy. Good guy. I'll tell you tomorrow. So, minimal change normally should be okay. It is one of the safer. In fact, if God were to say that you must have nephrotic syndrome, you must choose for minimal change. If your karma says you have nephrotic syndrome, the best is minimal change.
They say it's a disease that attacks children.
Correct. And some people it can also occur because of something else. I know it could have rarely cancer or some other thing which could cause. So since it's 2018, it's already 3 years and you're healed, I don't think anything to worry, but keep checking the urine. Do a urine exam, see whether there's any protein leak, that's the most important thing.
Yes.
Be observant on that, that's the main.
Yes, thank you.
Yeah, good news for you, basically. It's good to hear some good news from the doctors.
I know. Good to hear that, like,
all right.
good to hear some good stories, yes.
Yes.
We have Sri Mahalakshmi, who has the last question for the evening.
Sure. Welcome, madam. Yes, Mahalakshmi, please go ahead.
What is fatty liver?
I
want to know.
See, fatty liver was not there 30, 40 years ago. Now, because of our diet, excess of fat, alcohol, all this causes fatty liver. And fatty liver per se, if you go on a good diet, it will go away. But again, it depends on various stages. If you continue, process the fatty continues, it can go to liver failure and then liver transplant, that sort of thing occurs. But by and large, fatty liver is very common, we are seeing now in India because of the diet mainly, and alcohol. This is common in men, I have seen. Women, because of diet only. Otherwise, I don't think if the liver functions are okay, and if you've seen have you seen a gastroenterologist or liver doctor?
Yes.
Who is this for? Who is having this problem? It's not my field, but by experience, I can tell you that it's of late we are seeing this commonly. But if the liver functions are okay, I think it should be all right. And if the early stage, it can be reversed.
Great. And we will.
And definitely alcohol. Definitely, there's no question of alcohol. They cannot even smell alcohol. These people.
No. My husband is diabetic.
Diabetic can cause fatty liver. But early fatty liver, how old is he?
He is now 69.
I think we should be careful with the diet only. That's the main thing, and keep checking with the liver specialist if possible. Keep doing the scan. But by and large, the liver functions are all right. Be all right. Okay.
Great. Thank you, doctor. We have 2 more questions, but if you've got a rush, I totally understand.
Sure. I'll take it. Not a problem.
Okay, Bharati, if you're here and if you can speak, now's the time. She wanted to continue with her question regarding, I think, UTI.
Sure. We can take 2 more, no problem.
Bharati, are you here? Can you speak?
Who is this?
You have to unmute yourself, Bharati. She's
Bharati?
Go ahead.
Yes, Bharati.
Oh, we can't hear you, Bharati. There seems to be a problem with her audio. Bharati, why don't you type out your question? We'll go to the next question. Why don't you type it out? We can't seem to hear you. Okay.
Bharati is muted, I think.
No, she's unmuted, but I think there's an audio problem. And Krishna Kumar has his hand raised. So Krishna Kumar, would you like to?
Yes, Dr. Saab.
Yes, sir.
Kidney failure person can part with his partner.
Pardon?
Can he lead a family life, kidney failure person?
Yes, there's no problem at all. In fact, the problem is because of kidney failure, the libido comes down. But for a man, there's no problem. But a lady, if they've got kidney failure, getting pregnant is not easy. It will be difficult. Pregnancy is difficult. But for a man, there's no problem. Even with a transplant, for a man, within few months, we tell them to have a normal married life. For a lady, we ask them to wait, but otherwise, there's no issue. It's not an issue.
Okay, thank you very much.
No
Thank
it
you.
will not do any harm. It will not do any harm.
A person is above 69,
No
and
problem,
wife is near about 65, but he's having a kidney failure.
There's no contraindication. There's no issue at all.
So he's my friend.
In fact, it's good. In fact, as I said, it's good for the prostate. It's good. That's my opinion.
Thank you.
Okay.
All right, Bharti, maybe I'll put you in touch with doctor directly, or send me your question and I'll definitely have it answered. send it across to the doctor. Guys, with that, we come to the end of a very, very, very informative session. Doctor, thank you so much for
I must thank you.
your time, for extending your time. We're way past 7:30, so thank you for patiently answering everyone's questions. A huge thank you to Dr. Rama.
Thank you for your patience, sir.
Thank you.
Sankaran Sundar.
Thank you, sir.
Thank you for
Thank
your
you, sir.
patience.
Thank you.
Thank you, doctor.
Rama Ramchandran for introducing us to you and making today happen. Thank you,
Thank you,
everyone,
man.
for being part of this session today, and we will come back with more such really interesting webinars for all of you every month. So stay tuned. Thank you once again, Dr. Sundar.
Thank you. Thank you. God bless you.
Thank you
I'm
very
honored
much,
to be with
sir.
you all. Thank you. Take care.
Thank
Bye.
you.
All right. Good night, everyone.
Bye.
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 Thank you, folks, and good night.
Good night.
Good night and sweet dreams.
Bye bye, Miss. Good night. कल फिर मिलेंगे.
पता नहीं कल या परसों.
Okay, good night, everyone.
Bye, everyone. See you. Be good.
Good night.
Good night.
Thank you so much, Dipti.
Thank you, Dipti.
Thanks for the lovely session.
And Rima.
And thank you, Rima, also.
Thank you, Jeru.
Thanks a lot.
You're welcome.
Bye, everyone.
All of you are ready? All of you are ready, I hope, with your Valentines. Deepti is ready. You know that.
Oh, my darling, we have to sing mine now.
Yeah.
Clementine comes Valentine.
Please.
Yeah, we all are Valentines to each other, so it's okay.
For that reason only